5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. I told you that some of these routine tests, the very ones meant to keep you safe, could actually be pushing you closer to unnecessary surgeries, debilitating strokes, or even, and this is truly shocking, increasing your risk of cancer? It sounds unbelievable, doesn't it? Yet, the science is clear. New studies are revealing a hidden truth. Up to 37% of medical tests performed on seniors lead to treatments that aren't just unnecessary, but can cause complications or lifelong side effects. And here's the kicker. A staggering 99% of people over 70 have no idea they're being overtested. There's one test on our list, the #1 culprit, that's actually linked to 5% of all cancer cases in the US. That's the same percentage as daily alcohol consumption. You won't hear this on television, you won't see it on a billboard, but the truth is out there, buried in the scientific journals. Today, we're going to pull back the curtain. We're going to explore 5 health checkups that, after 70, might do more harm than good. We'll uncover the terrifying truth about what they can do to your body, all backed by real, credible science. And trust me, what made it to #2 will absolutely astound you. Before we dive in, I want to hear from you. In the comments below, let me know where you're watching from, your age, and if you've ever regretted a test or a procedure. Do you think seniors are tested too much? I'm personally reading and replying to every single comment, offering personalized tips and advice. And please, if this resonates with you, hit that like button and subscribe to our channel for more videos like this. Now, let's talk about the first test. It seems so harmless, so routine, but it has the potential to quietly, subtly diminish your quality of life. #5, the bone density scan, DEXA scan. The bone density scan. It sounds like a no-brainer, right? A quick, painless scan, no needles, no discomfort. You walk out knowing if your bones are strong or if you're at risk for fractures. It's comforting, isn't it? But here's the crucial piece of information that often gets overlooked, especially for those of us past 70. Past the age of 70, a bone density scan can often create more fear and anxiety than actual benefit. This scan, officially known as a DEXA scan, measures how strong your bones are, primarily to detect osteoporosis. But here's the reality for older adults, especially women. The results almost always come back showing lower density. And why is that? Because bone loss is a natural, inevitable part of aging. It's as normal as getting wrinkles or gray hair. It happens to everyone. And yet, armed with these lower density results, many seniors are then pushed into taking medications like bisphosphonates. These drugs are supposed to strengthen bones, but they come with a laundry list of serious side effects. We're talking about things like jaw necrosis, a rare but horrific condition where the jawbone literally starts to die, and severe esophageal irritation, making it painful to swallow. Here's the real problem. Studies have clearly shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. Think about that for a moment. A study published in the prestigious Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by a mere 0.3% after 5 years. Yes, you heard that right, 0.3%. That's not nothing, but it's certainly not the life-saving intervention many are led to believe. Instead, those women were far more likely to suffer from the medication's side effects, including digestive issues, inflammation in the esophagus, and even brittle bones that break in unusual ways. Let me tell you about Rose. Rose was a vibrant 76-year-old retired piano teacher. She never had a fall, no pain, and walked daily. After her annual checkup, she was referred for a DEXA scan. Her scan came back showing osteopenia, a mild reduction in bone density, not even full-blown osteoporosis. Her doctor perhaps well-intentioned but misguided, immediately started her on alendronate, a common bisphosphonate. 3 months in, Rose developed severe reflux and agonizing jaw pain. By the time she came to see me, she hadn't touched her beloved piano in weeks. Her joy, her passion was being stolen by a medication she likely didn't need. We immediately took her off the meds. We started her on a regimen of vitamin D, coupled with weight-bearing exercises like resistance bands and a calcium-rich diet. Think sardines and leafy greens. A year later, Rose was not only back to performing recitals, but she had stronger legs, better balance, and 0 fractures. A quick scan might seem like a smart move, a proactive step, but for people over 70 who aren't falling or breaking bones, the truly better option is lifestyle. Strength training, balance exercises, proper nutrition, and addressing any vitamin D deficiency have been shown to reduce fractures by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into a treatment you may not need. Your body is resilient, and often it just needs the right support, not a pharmaceutical intervention. But there's one scan that can lead to something even scarier than jaw pain, something that might even lead to brain surgery. Let's talk about that next. Number 4, brain MRI for memory loss. When seniors start to feel a bit more forgetful, a little more confused, the natural impulse is often fear. Fear of dementia, fear of Alzheimer's. And understandably, doctors often respond by ordering a brain MRI. It seems logical, right? Get a detailed picture of the brain, find the problem, fix it. But here's the uncomfortable truth I've learned over the years. MRIs, which are incredibly detailed scans showing the brain's structure, rarely give the answers patients are truly hoping for in these situations. In fact, most MRIs in people over 70 simply show age-related changes. We're talking about slight shrinkage or those little white matter spots that are completely normal in older adults. Just like your hair might thin or your skin might wrinkle, your brain changes with age. It's part of the beautiful journey of life. But here's the kicker. Once those spots are seen on a scan, they can trigger a cascade of fear, leading to further, often invasive, tests, and in some cases, even surgery. Surgery that may not improve memory and can actually make things worse. Consider this. In 2021, a study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaint. A staggering 86% showed some form of brain abnormality. But here's the critical part. Only 3% of those findings were linked to an actual treatable condition. That means a heartbreaking 97% of people went through the emotional toll of hearing, "There's something wrong with your brain," when in reality, there wasn't. Worse, nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague scan results that were likely just normal aging. Let me share George's story. George was a sharp, 74-year-old retired engineer. He came to me worried about forgetfulness. He was still incredibly astute, but he misplaced his keys more often and sometimes forgot names. His previous doctor, trying to be thorough, sent him for an MRI. The scan showed white matter changes. George panicked. He became convinced he had dementia. He stopped driving, stopped going to church. His world began to shrink. Over the next few months, his anxiety worsened dramatically. But when we reassessed him using a standard cognitive test, a simple paper-based exam, his score was well within the normal range for his age. We sat down, and I explained that those MRI findings were entirely age-appropriate. We then focused on lifestyle interventions, optimizing his sleep, ensuring proper hydration, and engaging in brain games and social activities. Within 3 months, his memory had stabilized, and he felt like himself again. His fear had been the biggest problem, not his brain. The truth is, unless there are severe neurological symptoms like seizures, a sudden and dramatic personality change, or a rapid decline in functional abilities, an MRI is rarely helpful in cases of mild memory loss. A far better first step, and one I always recommend, is a cognitive screening test. It's a simple, paper-based exam that effectively evaluates memory, attention, and problem-solving skills. It's inexpensive, highly effective, and most importantly, it avoids the risk of unnecessary panic and invasive procedures. Now, brace yourself, because the next test on this list is one you've probably had multiple times throughout your life, and it's number 3 for a very serious reason. Number 3, the cardiac stress test. This is one of the most common tests given to seniors who complain of mild fatigue, a bit of chest tightness, or just that general feeling of not being what I used to be. The cardiac stress test, a procedure that monitors your heart while you walk on a treadmill or a given medication that simulates exercise, is designed to spot blocked arteries. It sounds like a sensible precaution, doesn't it? But after 70, this test often does more harm than good, especially when it's used on people who don't have any clear, classic signs of heart disease. And why? Because it can lead to false alarms and, consequently, unnecessary heart procedures that carry serious life-altering risks. The core problem lies in its accuracy for this age group. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test says there's a problem when there isn't one, can be as high as 40%. Think about that. Nearly half the time, it's giving a misleading signal. This then leads to a cascade of follow-up tests, like angiograms, and even unnecessary stent placements or bypass surgeries. In 2017, a major study published in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or clear benefit from the procedure. And what was the outcome for these patients? They showed no improvement in survival or quality of life after the procedure. What they did have, however, were higher rates of bleeding, kidney injury from the contrast dyes used, and prolonged hospital stays. This wasn't just inconvenient, it was a significant setback to their health and well-being. This is exactly what happened to Raymond. Raymond was a spry, 75-year-old retired postman who stayed active by walking every day. During a routine checkup, he mentioned he sometimes felt a little tired on hills. His doctor, wanting to be thorough, scheduled a stress test. The results were unclear, so he was sent for a catheterization, a procedure that inserts a tube into the arteries to check for blockages. A mild narrowing was found, and a stent was placed. But that night, Raymond had a severe reaction to the contrast dye and developed acute kidney problems. He spent 6 days in the hospital and needed follow-up care for weeks. The fatigue he initially complained about, it never changed because it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and more rest between meals. His life was significantly disrupted, not improved, by a cascade of tests and procedures that began with a vague symptom and a routine stress test. If you're over 70 and not experiencing classic cardiac symptoms, I'm talking about chest pain during activity, significant shortness of breath on exertion, or a clear, noticeable drop in energy during light exercise, then a stress test may truly do more harm than good. A better, safer option is often a resting EKG, which simply looks at the heart's rhythm while you're still. Or even a coronary calcium scan, which is a low radiation imaging test that can show whether dangerous plaque is actually building up in your arteries. These are safer, simpler, and far less likely to push you into a procedure you didn't need. It's about targeted, smart medicine, not just throwing tests at every vague symptom. Number 2, colonoscopy. You probably didn't expect this one, did you? The colonoscopy. It's a procedure that uses a long camera to examine your colon, and it's been hailed as the gold standard for preventing colon cancer. And for many, it is. But after age 70, and almost never recommended after 75, unless there are very specific, compelling symptoms, a colonoscopy is not always a wise choice. The risks, my friends, go up significantly with age. Let's break it down. First, the preparation is harsh. We're talking about strong laxatives that can cause severe dehydration, dizziness, and even kidney issues in older adults whose bodies are often more fragile. Then there's the sedation used during the procedure. While generally safe, it poses added risks to brain function in older adults, sometimes leading to temporary confusion or even more prolonged cognitive changes. And perhaps most surprisingly, the test itself can cause serious complications. We're talking about bleeding, tearing, perforation of the colon, or even heart rhythm disturbances during sedation. These are not minor inconveniences, these are medical emergencies. A powerful 2019 study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. What they found was sobering. For every 1,000 colonoscopies done in patients over 75, only 2 lives were saved. But here's the devastating part. Over 20 people experienced serious complications. That's a 10-to-1 risk to benefit ratio. Think about that. For every life saved, 10 people suffered a serious complication. And even when polyps are found, many are small and slow-growing, especially in older adults. Removing them can sometimes do more harm than simply leaving them alone, particularly if they are unlikely to ever become cancerous in one's remaining lifetime. Let me tell you about Dana. Dana was a vibrant 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in stool, no family history of colon cancer. But her new primary doctor, fresh out of residency, urged her to get a screening colonoscopy. She agreed, trusting her doctor. During the procedure, a small polyp was removed and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation, a tear in her colon. She spent 9 days in recovery, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already had 2 clean colonoscopies in the past. There was absolutely no reason to repeat it. Her life, and her daughter's, was turned upside down by an unnecessary procedure. The US Preventive Services Task Force, a leading independent panel of national experts in prevention and evidence-based medicine, currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, a non-invasive fecal test done at home, is often a much safer and equally effective option. It requires no prep, no sedation, and still catches most concerning cases. Ask your doctor about these alternatives, because once you're in the colonoscopy pipeline, it can be incredibly hard to get out. It's about making informed choices that truly serve your health, not just following a rigid protocol. And now, we've reached the most overused, most dangerous, and arguably most harmful checkup for seniors. And I can almost guarantee you've almost certainly had it done. Number 1, annual full-body CT scans. This is where we get into truly terrifying territory. Full-body CT scans. These are sometimes offered as part of executive health packages or as preventive services in private clinics. They're marketed with a compelling promise to catch cancer early, to give you peace of mind. But here's the shocking, deeply unsettling truth. These scans expose your body to an incredibly high dose of ionizing radiation. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is incredibly, incredibly high. And the bitter irony is this: there is zero evidence that full-body scans without symptoms actually save lives. Let's talk about the radiation. Each full-body CT scan delivers between 10 to 20 millisieverts of radiation. To put that in perspective, that's equal to around 500 chest X-rays. According to a sobering 2023 modeling study published in JAMA Internal Medicine, the dramatic rise in CT scans across the United States may now be responsible for up to 5% of all cancers. Yes, you heard that correctly. That puts them on par with daily alcohol consumption as a cancer-causing factor. That means 1 out of every 20 cancers could potentially be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's absolutely terrifying. The problem is, these scans are incredibly sensitive. They can detect tiny, harmless nodules, calcifications, or cysts that are simply a normal part of aging. Your body isn't perfect, and it accumulates little quirks over decades. But the moment these findings are seen on a scan, a red flag goes up. This triggers more scans, then often invasive biopsies, and then, inevitably, panic. The patient and their family are plunged into a terrifying journey of uncertainty and fear, all for something that was likely benign and would never have caused them harm. Let me tell you about Marcus. Marcus was an incredibly active 80-year-old who used to teach martial arts to younger seniors. He felt great, vibrant, full of life. He decided to take part in a senior elite checkup at a private clinic, which included a full-body scan. His scan showed a tiny 3-millimeter lung nodule, a speck. But that speck set off a chain reaction. He was immediately referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy of his lung. The result? Benign. It was nothing. But the biopsy itself collapsed part of his lung, leading to hospitalization and a 2-month recovery period, all for something that could have been and should have been left alone. His active life was put on hold, his peace of mind shattered, all because of a scan that promised peace of mind but delivered trauma. Experts are now incredibly clear. Full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is unequivocal, there's no proven benefit, and the potential for harm is significant. If there are genuine symptoms, unexplained weight loss, coughing up blood, visible swelling, then targeted imaging makes absolute sense. But scanning the entire body with no specific focus is like searching for treasure with a landmine detector. You might find something, but the damage inflicted in the search could be far worse than what you were trying to avoid. A safer, smarter approach is to listen to your body. If you feel well, maintain regular checkups with your primary doctor, and only pursue tests that are clearly indicated by specific symptoms or a strong family history. Your time, your energy, and your precious health are far too valuable to waste on fear-driven screenings that could leave you worse off than where you started. So there you have it, 5 checkups that may seem helpful, even essential, but can actually hurt, especially once you're past 70. Modern medicine is a powerful, incredible force for good, but it's not perfect. Sometimes less truly is more. Always, always ask your doctor, what happens next if this test finds something? If the answer is unclear, if the risks outweigh the potential rewards, it may be time to pause, to question, and to seek a second opinion. And remember, true prevention, the kind that genuinely protects and empowers you, starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Be an advocate for your own health. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching, and remember, your health is your greatest wealth.